Hello, dears, and welcome to Al-Hussaini Virtual Lab Pathology Talks, Tips, and Practical Tips. What I'm going to be sharing with you today is a very important tip for rendering a proper diagnosis. This is a case of atypical polypoid adenomyoma. So this is a 34-year-old female patient who presented with abnormal vaginal bleeding, and she underwent DNC. This is one of the fragments of the DNC. And from the low power magnification, you can see a complexity of the glandular growth pattern, which somehow you will be questioning whether there is a reversal of the glandular to the stromal ratio. So you're thinking, is this hyperplasia or not? But remember, she's only 34 years old, and on a higher power magnification, there is a proliferation of the glands with the branching and the squamous morules. Again, here cribriform proliferation of the gland, reminiscent very much of hyperplasia, endometrial hyperplasia, probably atypical endometrial hyperplasia. Again, another focus where we have really the complex branching of the glands, and here the tendency at the start of cribriform proliferation. We have the squamous morules, and then we have the fibromatous stroma with some inflammatory cell infiltrate. And zooming in more on high power magnification, these are the glands which are branching with some stratification of the nuclei, small inconspicuous nucleoli. And then we have the stroma, squamous morules, and we have the stroma, the fibro-inflammatory stroma in the background. And at the edge of one of the fragments, we start to see what looks like a smooth muscle, and as if this proliferation is invading or infiltrating into the smooth muscles that are included in the biopsy. Now, focusing on, it's very important, really, the squamous morules are extremely important to look at because they bear important tip or a clue to the diagnosis. So this is the squamous morule, or the morule as is now being really termed, because apparently most of those are not really squamous differentiation, and these are the edges of the glandular proliferation. And characteristically within those morules, you start to see areas of necrosis and sometimes large areas of necrosis. Excellent clue to the diagnosis of atypical polypoid adenomyoma. Also important to note that some of the fragments will contain normal endometrium, and this is secretory in the endometrium in the background. So we have like the contrast between the a tumorous proliferative process or fragments, and then the normal fragments in the background. Important immunohistochemical stain to apply is SAT-B2, because in the normal stroma, and we're talking about the stroma, this is the normal endometrium, the SAT-B2 is completely negative, while it's typically positive in the stroma of the atypical polypoid adenomyoma, highlighting really the stroma. This is another focus where we have the glands, and then we have the SAT-B2 positivity in the stroma, and a third and a fourth focus just to give you really the sense of the positivity of the SAT-B2 in the stroma of the lesion, in contrast to the stroma of the normal endometrium, which would be part, or which would be the background if we have hyperplasia. Now, for a smooth muscle actin, because we might suspect, for example, that this is an infiltrative process, in contrast, the smooth muscle actin is completely negative, and this arteriole serves as an internal positive control. And another focus, complete negative smooth muscle actin immune stain in the stroma in the background. So to sum up, this is a young female. Remember, she is a young female with abnormal vaginal bleeding that was found to have this complex endometrial proliferation, very much reminiscent of and you would think of endometrial hyperplasia, but remember this diagnosis, the atypical polypoid adenomyoma. The clues are the presence of the squamous morules, especially those with necrosis, the normal endometrial fragments in the background being proliferative or secretory, the SAT-B2 positivity in the stroma, and the negative smooth muscle actin positivity collectively, in addition, of course, to the age, can lead to the proper diagnosis and thus saving the patient from undergoing unnecessary procedures. Now, if you contact the gynecologist who performed the biopsy and ask him or her a question, was the lesion polypoid? Once this is affirmed, this is another clue to support the diagnosis of atypical polypoid adenomyoma. I hope you find this tip useful in your daily practice. Thank you.